the lack of access to education and trusted resources can really have a negative impact on the patient's journey. And for anyone here who has interacted with the cancer care ecosystem, you know that it's incredibly fragmented and challenging to navigate at best. Perfect. My name is Jessica Thurmond, and I am the co-founder and co-CEO of Athelo Health, where our mission is to democratize integrative cancer care. It comes as no surprise here. Everyone knows someone who has or has had cancer. For me, that someone was my mom. She was diagnosed with breast cancer back in the late 90s when she was in her 30s. She came from a poor background, descendant of the Wapton Oiate Sioux tribe from Sisseton, South Dakota. And what we saw firsthand was how the lack of access to education and trusted resources can really have a negative impact on the patient's journey. And for anyone here who has interacted with the cancer care ecosystem, you know that it's incredibly fragmented and challenging to navigate at best. But what if you're a patient from a poor population or a rural community where less than 3% of oncologists practice? We've been anticipating a shortage of over 2,200 oncologists in just the next 3 years alone, and those numbers were taken before COVID-19. If you take that at an average of 4,500 patients that each oncologist sees, that's nearly 10 million patients who are going to be faced with a lack of adequate care. The good news is that, the investment within therapeutics is fantastic. And for many, cancer is now a chronic manageable condition with around 90% of breast cancer patients entering into remission. But what that also means is the number of patients will continue to grow within the cancer care ecosystem who could be facing recurrences of disease in the future. We talk about the 80-20 paradigm a lot, where around 20% of what happens with a cancer patient is within the clinic. So that's your chemotherapy, your labs, things like that. But what about the rest of a patient's life that we so often are missing? 57% of side effects are often missed in between visits. And so often the patients who are costing our cancer care ecosystem the most money are the patients who don't have access to integrative medicine. Which brings us to Athelo, where we're really founded upon 3 pillars. We are the first virtual supportive care tool designed specifically for the needs of women with cancer. We are starting our journey in the breast and gynecologic space, but we'll be opening it up to all women with cancer in the next year, and we're very excited for that. The first pillar of which we're founded on is biometric integration. And this means we work with common wearable devices like Fitbit, as well as digital biomarkers that are passively collected through a cell phone to be able to track patient progress and help them gain insights into how they can improve their clinical and non-clinical outcomes. The second is being able to put patients in front of health coaches in combination with group sessions as well as individual sessions. This enables patients who typically may not have access to support groups or care from outside of their community setting. The lastly is health literacy. We do a pretty incredible job of making the information really difficult to digest for patients, especially within the cancer care field. So we take scientifically validated knowledge and we distill it down to an 8th grade reading level in a variety of formats, ranging from short form to blog posts to videos, because we know that every learner is different, and we want to be able to tailor that experience. In terms of our differentiators, we cover the entire treatment span. So from the point that you've been diagnosed with cancer all the way through remission, and if you have been diagnosed with a recurrence of disease, you can be on the Athelo platform. Our utilization of biometrics is incredibly exciting. There's a lot of new information and data that's coming out looking at these as potential tools for prognostics and risk assessment in these patient populations. We also focus on the specificity of our product. We know that women are at a significantly higher risk of serious side effects of not only chemotherapy, but immunotherapy and targeted therapies. As Yusuf mentioned, it wasn't until 1993 that women were allowed to be in clinical trials even. So we're trying to take this real world evidence to better support the decisions that are being made and support our care management teams. And lastly, we have been designed for underserved patients. We are looking into public plans as well as working and collaborating with CMS in order to be able to bring a treatment option like this to the patients who need it most. I won't spend a whole lot of time on this. I think everyone here should know that cancer care is incredibly expensive, with 1 in 4 patients filing for bankruptcy. And every year, the cost is continually increasing. And the more patients that we have within that, the more that we'll see that inflate. And our goal is to be able to not only improve the patient experience, but reduce the total cost of care in the patients who are most at risk. We are developing our current customer pipeline, and we are collaborating on our first couple of pilots that will be launching at later this year, as well as one early next year. Our goal. We're working within the Care First Blue Cross Blue Shield network in the 1501 Health program, and are very excited to collaborate within that network. Our goal within our partners, and is a B2B SaaS platform, is to improve the CHAPS score for patients. So these are metrics that are often used to decide on reimbursement rates, as well as the star rating for CMS, and improve the overall quality of care in terms of engagement, adherence, and retention of patients, as well as the satisfaction of the existing care management teams. We've been in a number of accelerators, including this incredible one, the California Healthcare Foundation. We've been collaborative across research, and we are moving forward in market over the next year and are excited and looking for additional partners. My name is Jessica, and I am the co-founder and lead the product development and clinical development for Athelo. My co-founder, Monica, leads commercial strategy, and Mark Short is our chief technology officer. We've done our best to surround ourselves by the smartest people we can find to bring a novel product to market for individuals who typically get the worst of the worst whenever it comes to their care. Let's join together to bring them the best. Today, we're looking for additional CMS introductions. We are raising currently, so if any investors, not only institutional, strategic, or angel, are a great product fit, as well as alignment in terms of our mission and values, we welcome that, as well as any potential partners for the future as we continue to scale. Thank you so much for everyone today, and I welcome any questions.
But Jessica, given the average age of diagnosis is in the lower 60s, how do you really plan on engaging populations who may not be as comfortable with technology?
Yeah, it's something that's one of those things that's kept me up at night frequently since we've started this, but twofold to that. One, the passive data collection in phones, everyone has a cell phone these days. And I think that more and more people are becoming adept with it, but we can really passively collect a lot of this information from digital biomarkers as it is. The second piece of that is that we are seeing an incidence rates and trends of older adults commonly using wearable devices and having more tech experience. But on the flip side of that, we are also really excited to be launching our caregiver portal this year. So we have created a new platform where a patient can authorize a loved one or an authorized representative to have access to their data and also input data and help along the journey in case you do have a patient who isn't able to input that themselves.
I'm assuming that a large percentage, if not all, of these patients have some form of caregiver who is helping support them as they navigate their cancer journey.
Yeah, absolutely. I mean, I think that's one of the things that we realized early on with our testing of the product is that, when a patient is making a decision about their care pathway, especially when it comes to the more social aspects, like the financial toxicity of cancer, can you make it to your appointments? That all boils down to caregivers, means so much of it boils down to what your team is around you. And our goal is for Athelo to simply be a companion to that team.
As you think about scaling your revenue model, are you looking at specific CPT codes? Are you thinking more population health management? What's your viewpoint on that go-to-market?
Yeah, so I mean, we do have existing CPT codes that we can bill for that are built in. I think, I hope that from a policy perspective that more come forward. And, I think there are a lot of things in flux right now with the end of the pandemic legislation. But, on the other side of that, we are looking at the potential for at-risk contracts, working with risk-based providers and ACOs. And then also a more standard PMPM. And I think kind of the name that we've seen there with these contracts, instead of necessarily PMPM, is per activated member per month. And that's, a contract model that we have found to be pretty successful in negotiating early deals.
And then finally, Jessica, is there something, we all live our mission every day when we roll out of bed, right? But is there something in particular that you're excited about for the coming years with Athelo?
Yeah. I mean, so I'm a research nerd. Like my background has been, research for over a decade now in the cancer care space. And for me, I'm most interested about the utilization of biometrics and digital biomarkers as prognostic tools. There's really cool research that's coming out looking at predictors such as heart rate variability as a predictor of progression and recurrence of disease. So I think, kind of our goal in the next year as we start training on some of our models is to be able to have greater insight into how we can make the most efficient and effective decisions for cancer patients when truly it's a condition that every single day matters whenever you're making a decision on what sort of therapeutic or treatment options are available.